Welcome to Between the Sheets, the podcast where we're going to cover a variety of topics related to sexual health and wellness. I'm Dr. Stephanie Zwonitzer, your host. I'm a nurse practitioner and have been in practice since 2017. I have my Doctor of Nursing Practice degree, and I specialize in urology and sexual health. I am so excited to explore all of the various topics related to sexual health and wellness with you in a fun, spicy, educational, and non-judgmental manner. So come on. Let's get between the sheets. Hey everybody, welcome back to Between the Sheets. It's just you and I today, no guests. I have a great topic for us tonight, recurrent urinary tract infections. I'm going to specifically focus on this from the woman's perspective. Some women have the recurrent UTIs because of having sex. Some women don't. So part of the topic is sexual health and part of it is just overall health for women. But I think it's a really important topic. I see women for this very regularly in my office. And so I do think it's a prominent topic out there that needs to be discussed. So we'll kind of go through it in the age ranges. So for our younger women, young adults that have recurrent UTIs, it can be hygiene related. It can be, not getting enough hydration. It can be from sex or masturbation with sex toys or not, cleaning well. It can be from exercising and not changing out of clothes quickly with the sweat and bacteria on them. Same thing with hot tubs and pools, not getting out of there or not changing out of your bathing suit directly after being in those waters as well. So for our younger ladies, certainly going to talk about hygiene. And this is going to go for all age groups. So let's touch on hygiene here. We all know wipe front to back. As ladies, we have been taught that for years since we learned how to wipe ourselves, right? And that's basic hygiene. We definitely want to do that. You don't want to bring things from the backyard to the front yard, but that's really the basis of hygiene when it comes to female genitalia and preventing UTIs. So we want to wipe front to back. We also, although there is no research that proves that this works, we all believe it works. You pee after sex. I also tell my patients to do this after getting out of a pool, hot tub, the bay, water, any type of water. Pee after these activities, it pushes the bacteria out of your urethra. As women, our urethras are very short. Inch or two. And so bacteria can crawl up there pretty quickly. So if we push them back out by voiding after sex or after being in water, then we can certainly help prevent the UTIs. Again, there's no research that shows that, but it is more than just an old wives' tale is what I'll say. I think it's pretty accurate. Another great way to kind of clean up down there, especially after sex, is using a bidet. I got my bidet insert off of Amazon for, I think it was $30. Maybe they're a little bit more expensive now because I've had mine for several years, but they clip right into your toilet, hook into the water supply. I did it myself. I am pretty handy, but you can do it too. It's very simple. It comes with all the parts that you need. And it's just a really great way. Yes, you can use it for bowel movements and washing your rectum and your anus, but certainly you can kind of tilt forward a little bit and wash the vagina, the urethra, the whole vulvar area, which is really great if you've used lubricant for sex, if you're having kind of some sloppy sex with lots of moisture down there and fluids. And then you can also use it when you get out of swimming in different bodies of water as well. I also really like using the bidet after loose bowel movements. So if you have a bout of diarrhea, it works really good to just kind of clean that up. If you think about when you have diarrhea, it kind of all that bacteria is pluming inside of the toilet while you're going. So give it that flush and then go ahead and use your bidet to kind of rinse everything off, make sure there's no bacteria left behind. I do not like the flushable wipes for multiple reasons. Number one, they're not good for our pipes or our environment. My godfather volunteers at a water supply plant and told me that it really does some damage in there and blocks things up and they have to go in and kind of get things out and whatever. So they are not as disposable as they like to claim they are. Please do not use them. They are irritative to the skin. They have products in them. They're just not great. I have also listened to GI doctors talk about the fact that this can increase irritability at the anus as well with both hemorrhoids and just skin irritation back there. So really avoid the flushable wipes. If you really feel like you need to wash down there with some type of cloth, get out a clean washcloth, put some warm water on it, use it the one time, throw it in the laundry, and the next time you need something, you can use a new fresh washcloth. But the flushable wipes at any age are just not great. They spread bacteria around. If you think about They come in these packages and you go in and out of the package every time. And every time, then you're leaving a little bit of bacteria behind it. What do bacteria like? Warm, moist, dark environments. And when you close that bag of tissue, wet tissues, you're just allowing that bacteria to proliferate, and then you're wiping it on yourself, plus all the skin irritants and chemicals that are in there. It's just bad news bears. So go ahead and skip over the flushable wipes down there, any of the Vagisil wipes, things like that. You really just water and a washcloth if you feel the need to scrub up down there. Okay. Number one cleanser for down there is water. Whether you're showering, bathing, just doing a quick tits, pits, and ass kind of wash, you just don't want anything in the vaginal area besides water. And the reason for that is think of your vagina as a self-cleaning oven, okay? That is why we have discharge, is that area of us sheds skin cells very rapidly, keeps that area very healthy. That's why our pH balance is so important for the health of our tissue down there. If you use soaps, lotions, powders, douches, sprays, any of those things, even if they say that they are made for the female area, they can throw off your pH, make you more susceptible to bacterial vaginosis, urinary tract infections, lots of stuff. So stay away from any products in that area besides water. Yes, you will still be clean. No, you will not smell unless you have something else going on. Great hygiene is water only. Like I said, if you want to use a washcloth, go for it. Make sure it's clean every time that you wash in that area. Some other hygiene things alongside of the, no products in that area, there are new full body deodorants and things like that are coming out. I just use a lot of caution with those. If you're not getting it right in the vulvar area and kind of using it in the creases of your legs, that might be okay, but certainly everybody is going to be susceptible to different things. So be very careful there. One of the things that I love best for recurrent UTIs is a cranberry supplement. So whether it is for our younger ladies or our older ladies, our middle-aged ladies, whoever you might be, even men, it works really well for. The cranberry supplement that you're going to look for is not necessarily brand specific, but you want to make sure that it has 36 milligrams proinstinidids in it. That's abbreviated as PAC. That's the part of the cranberry that benefits the bladder. It makes the inside of the bladder a little slippery. And so the bacteria can't hang on and adhere to the sides of the bacteria and really wreak havoc inside of you. So it's great. Take one every day. I get mine off of Amazon. I have it on automatic subscription, so I don't even have to think about it. It shows up. I take one every day. I don't have any issues with this. It's great for overall bladder health as well, but specifically for my ladies who are susceptible to recurrent UTIs, you should definitely be on this. It's going to help with all the symptoms as well as prevention of infections. It's a great part. The other thing that we want to talk about, especially for our younger ladies, is if you are getting the recurrent UTIs when you're having sex, you want to make sure that your partner is also not using any products in their private area. So whether that is a female or a male partner, trans partner, whatever, you want to make sure that they are not using any lotions, powders, douches, sprays, etc. that you wouldn't use on yourself. You don't want them using it on them in the areas that are going to get on you as well. So really trying to prevent the exchange of those types of products. And then the other thing is, if it really is happening, every single time you have sex, we can do what's called postcoital antibiotics. We can give you a little antibiotic. It's a minimal dose. You take it within an hour of having sex, no more than once a day. It does a really good job of helping prevent those postcoital, post-sex UTIs. If it is only after a certain type of sex, if it's only after a really long session, or you only see your partner every couple of weeks, and so you have a really fun time that weekend, get it all in, and then you don't see them again for a while, so you're really not building up any ability to prevent the UTIs and things like that, then we definitely want to talk about postcoital antibiotics to help you get through those time frames. If it's a certain type or a longer session of sex, maybe you only take your postcoital antibiotic after that type of sex versus every single time that you do something. So you'll kind of play with that and talk to your provider about it. I like to use Macrobid. Nitrofurantoin is the generic name. It's one of my go-tos. I'm using a low dose. There's plenty of other ones, Ceftonir, low dose Bactrim, something like that. There's several that we can choose from based on, what your UTIs have grown and have susceptibility to in the past, as well as, taking into account your allergies and things like that. So really good hygiene, maybe some postcoital antibiotics, definitely getting you on some cranberry. This is for our younger ladies who have not gone through menopause yet. So anywhere from puberty through young adulthood. Certainly if you're having urinary tract infections when you're pregnant, you want to be talking to both your urologist and your obstetrician. OBGYN, sorry, for that, because we want to make sure that the antibiotics are appropriate for your pregnancy and just kind of make sure that we're hitting it from both sides. There are certainly some times where the uterus pushes on the ureters, which are the tubes that connect the kidney and the bladder, and not allow the flow of urine quite as easily. And that can put you at increased risk. So you want to make sure that we're both on board, the OBGYN as well as the urologist, and we can help you manage that very well. So the next phase of recurrent UTIs that I like to address is my postmenopausal ladies. And again, this can be after sex, it can just be random, whatever it is. If you are having recurrent UTIs, especially if it's a new onset and you are in the process of perimenopause, menopause, or postmenopause, the biggest thing that we can talk to you about is estrogen. So some vaginal estrogen is very safe, number one. Okay, let's rewind back to 2002 when the study about estrogen came out and made everybody think that if they'd even thought about estrogen, they were going to get breast cancer and die tomorrow. That is not true. That research study has been disproved multiple times. The researchers have come from that study have come out and said that they relooked at the data and what they originally correlated was not appropriate. It is not significant, and the risks with estrogen, both systemic and local, are not nearly as significant as they tried to portray. So talk to your provider, talk about your personal risk factors. Have you had breast cancer? Have you had endometrial cancer, ovarian cancer, any of the female oriented cancers, especially if they're estrogen sensitive? We want to talk to the oncologist as well. Any of my ladies that have currently or have had breast cancer or cervical, endometrial, all of the female cancers, we always get the okay by their oncologist before we start any estrogen. I only have 2 patients that have been told no, and both of them had endometrial cancer. So even estrogen positive breast cancer, I have had oncologists okay the vaginal estrogen for, not necessarily systemic. But because in my practice, I mostly focus on the vaginal estrogen, that's where I come in. So it is very locally absorbed. There's research study after research study that shows that it does not change your blood level of estrogen. So it doesn't get into your whole system. It is locally absorbed. It helps with the perineal area. So why is that important? Well, estrogen is really important for our perineal health. It helps make sure that adequate blood flow is going to keep the tissues healthy and to fight infection. It helps keep us lubricated. It helps keep our tissues nice and thick and healthy so they don't tear easily, which increases our susceptibility to infection. And there's also what's called genitourinary syndrome of menopause. And this is where you can also get symptoms like urgency, frequency, irritation, itching, burning of the skin in that whole area. And all of these things can make you more susceptible to urinary tract infections. And so putting a little bit of vaginal estrogen, the way that I prescribe it is if I give you a cream, you put it in the vulvar area, so on the outside in the labias and on the outside of the vagina, and then a little bit on the inside of the vagina. Rub it in for about 10 seconds, twice a week at bedtime. And what it does is it replaces the estrogen to that area. It makes your tissues healthier. It makes them thicker. It increases your lubrication again, and it decreases your risk of recurrent UTIs by about 80%. So if you are postmenopausal and you do nothing else besides vaginal estrogen, you will improve your rate of urinary tract infections by at least 80%. It is a phenomenal intervention that we can do for you. It's pretty cheap at this point. There are some name brands that are a little bit more expensive, but for the most part, it's pretty cheap. And it really is a miracle worker. The good thing about that, especially since we're talking about sex on this podcast, is that it also helps with the lubrication, the pain with sex, the elasticity of those tissues so that you can take something into the vagina if you're trying to do so. And so it really, I've had a lot of women come back and tell me, maybe we started them on it for recurrent UTIs, but man, their sex life has gotten better because they can actually handle penetration now. They can use less lubricant because they're able to make some of their own again now. So it just makes sex more pleasurable as well. So vaginal estrogen is a really big deal for my postmenopausal women. And yes, it is very safe. Now, you can also use systemic hormone therapy, and that can help many, many, many things throughout your entire body. We'll do a whole nother episode just on hormone replacement therapy because I am fascinated by it. But in relationship to whether or not you can use systemic therapy and local vaginal estrogen, you can. It is completely safe to use both of them. We recommend that you use them in conjunction. I have a lady that came to see me a week or so ago, and she had just started on the systemic. So we decided to hold off for about a month or two, make sure that she's doing okay on that, and then we'll start the vaginal estrogen. And the biggest reason for that is we don't want to start too many things at once. We want to know that if you have an adverse reaction, something goes wrong, we know what it's from. And if we started both the systemic estrogen and the topical estrogen at the same time within a week of each other, we wouldn't know necessarily which is which. We could take a pretty good guess, but this way we'll give it a little time and we'll get her on the topical next. But that is definitely my number one intervention for my postmenopausal ladies. It's a great tool for us. And then also we can do postcoital antibiotics. Also for some of my ladies who get UTIs regularly, we test them for it. We know they're true UTIs and not just symptoms that the ladies are having, which is a whole nother discussion of interstitial cystitis and when you have symptoms of a UTI without actually having a bacterial infection. But for my ladies who are older and going down this route, and we know that they have true UTIs, I may start them on some self-start antibiotics where they just get to keep a dose at home and they know when they need it, they know to take it. I do not do that with my ladies who sometimes have infections, sometimes don't, but regularly have symptoms, because I don't want you taking antibiotics when you don't need it. So it has to be tried and true for my ladies who we know they have them. It's the same bug every time, and then we can get them started on something. There's also a subset of my ladies as you get older that we just can't get it under control. We've done all the tests and anatomically you're fine. You just have a very weak immune system for a variety of reasons, whether it's an autoimmune disorder, medications that you're on, just older age with a decreasing immune system, things like that. So the other thing that we will do is do a nightly antibiotic. Again, I like to use a low dose of macrobid, Bactrim, Cefdinir. Some of those are my favorites to go to, but I will use this. I try and do it for a short course first, so 90 days, and then take a break and see if we've gotten you to a point by also incorporating everything else with the estrogen and the cranberry and the good hygiene and the lots and lots of water, at least 64 ounces a day. If we've gotten all of that and you're still having UTIs at least once a month, we can do this 3-month course. Now, for my ladies who are much older that probably aren't even listening to this podcast because they're in a nursing home or something else, but maybe some of my ladies have a mom who's listening. If you're at the point where you're incontinent, you're bedridden, wheelchair ridden, you're not very active anymore, and you're getting recurrent UTIs, I put those ladies on not just for 90 days. We just do a nightly dose. Every once in a while, they will still get a UTI from a bacteria that is not susceptible to that antibiotic, but that does do a really great job of suppressing that in our ladies who just really can't tolerate or are not capable anymore of really good hygiene and using the vaginal estrogen and things like that. For my ladies who still can, I start with 90 days. We take a break. We see if we broke the cycle. A lot of times that breaks the cycle. And then if we do get into a bout here and there with some recurrent UTIs going forward, we might do 30 to 90 days again of a daily antibiotic. But in general, really want to do short courses of antibiotics. Only want to do antibiotics when you are symptomatic and test positive for a UTI. So let's talk about that. So when you have symptoms, frequency, urgency, burning, maybe you see some blood in your urine, maybe you have a little bit of lower back pain because it's kind of gotten to your kidneys. Those are the symptoms that you want to go get checked out. Sometimes fevers and chills. For patients over the age of 65, your first symptom is going to be confusion and increased tiredness. And you're going to have a lot of that. So if you have some confusion or some fatigue at baseline, it would obviously be more than that, right? So it would be a change from your normal. That's when you want to come in and get tested. Whether it's with your urologist, your primary care, urgent care, emergency room, wherever you can get in, go get tested. They should be not only taking a sample of your urine and doing what we call a dipstick, a quick test, they should also be sending it out for culture. The reason sending it out for culture is so important is because we need to know what bug it is that's causing the UTI. Then we can run susceptibility on that bug in that UTI, that same specimen that you just gave us, and we can see whether or not certain antibiotics work. And that allows us to know that we're treating it effectively. So for my ladies with recurrent UTIs, we have all had a UTI where the first antibiotic doesn't work and we're 2 to 3 antibiotics down before we finally feel better. Most of the time that's happening because you didn't get a culture to begin with and either called in and somebody gave you an antibiotics without a urinary test at all, or you did the UA, but they didn't send it out for culture. And now we're just kind of guessing what antibiotic. Most of my ladies, I won't start antibiotics unless you're very symptomatic until I get the culture back. If you're having a lot of symptoms, I will go ahead and start you on something and know that we may have to change it based on the susceptibility when that comes back. The other reason that the culture is so important is if you are getting recurrent UTIs, we can look at them. Is it the same bug every time? Is it, if it's E. coli, which is from the stool, do you have a fistula, an opening between your rectum and your vagina or your rectum and your bladder that is causing you to have this exposure to E. coli frequently that puts you at this increased risk? If it is some other type of bacteria, what is the source of that? How can we help you mitigate that and decrease your risk from there? And that also helps us if we do need to do a longer course of antibiotics, looking at the consistency of these, which one is susceptible the most often and which one can we use for that. So it's really, really important. Call your urologist, your primary care, urgent care, whatever. Just make sure that they do send it out for culture, because that'll make a big difference in your treatment plan. I think that's really the biggest things for recurrent UTIs. Get checked out. In our workup, we will do an ultrasound of your kidneys and your bladder to make sure nothing anatomically is contributing. Sometimes we do a cystoscopy, which is a camera test that goes up and looks at the integrity of the urethra and the bladder. But a lot of times, if I talk to my ladies about the hygiene, drinking at least 64 ounces of water, using the estrogen if it's appropriate for them, and really good hygiene, cranberry, those kinds of things. Those pillars are what is successful for my ladies. And so that's really where I start. If we can't get you under control, then we get a little bit more invasive. We do the imaging, we do the cystoscopy, we do those things. But for the most part, the tips and tricks that I have for you work very, very well. So please, please, please adhere to them. Please get checked out if you think that you have UTIs. And if you're having recurrent UTIs, get yourself a good urologist in your area. If I'm in your area, come see me and we'll get you feeling a lot better. It's time for my favorite segment of the show, Between the Sheet Shenanigans. We've got some great stories for you, and as always, the details of the stories will be changed so that you cannot identify who the owner of the story is. It might be my story, might be my friends or family members, or even a patient's story, but you're not going to be able to tell. Please send in your stories as well so we can shake up the details and share your stories. Send them into podcastbetweenthesheets@gmail.com. Let's tell some stories. So I have a friend who got a UTI for the very first time after having sex with a new partner. She had been with her previous partner for 10, 15 years. They had ended and she got a UTI and was like, oh my gosh, like, what is this? I have so much pressure in my pelvis and I'm peeing all the time, but there are these little amounts and it just hurts really, really bad. And a couple days of this, so she went to go to urgent care and sure enough had a urinary tract infection. But it was her first one, so she didn't really know. Got it treated, figured it out. About a couple weeks later, she saw the guy again, had sex, boom, UTI. It happened a third time. And then she finally started to realize that, oh, this is it. And so for her, that told her that this man just was not the right man for her. She didn't care that this just happens. I have married couples that this happens to, whatever. This for her meant that that man was not right for her. That was her body rejecting him and she was done. And she still holds this belief about 15 years later. And when she dates, if she gets a UTI, he's cut right off. And if she doesn't, she might try and date that person a little bit. But I think it's a great story. I love that is her litmus test for whether or not a man is right for her, but it's not accurate. You can have recurrent UTIs from a partner that you're with forever. You can have a urinary tract infection from a one-night stand, whatever. It doesn't matter. But I love that for her, that's her litmus test. And I think that's hilarious. I had a lady come in who she was just at the end of her rope. married to her husband. He had urinary tract infections so recurrently for so many years, to the point where her and her husband just stopped having sex because she was so sick of it. He would go to touch her and she would just like clam up and tense up and just not want anything to do with it, because she knew 2 days later she was going to be having a UTI and all the pain and side effects that go with that. And so we talked to her, and we kind of pulled through some stuff and did all the testing, and everything was fine. And so we started her on she was postmenopausal, so we started her on some vaginal estrogen, also started her on a postcoital, or also known as post-sex, antibiotic. And she did fantastic. She felt better in her vaginal area because of the estrogen cream. She had less urinary symptoms, and she enjoyed sex and did not get UTIs because she took her antibiotic afterwards. So that was a really good success story. Her and her husband are very sexually active now and enjoying that, having a lot of fun with that. I had a young girl come in, young to me. She was 20, 21, something like that, but that's young to me. I'm 40. So she came in and she was just thought something was wrong with her. None of her friends got UTIs. She got UTIs repeatedly over 3 or 4 years. She finally felt like, she would come and get checked out. She was kind of embarrassed for a while. She thought maybe she was dirty or whatever. And she turned out to have a very large kidney stone in her kidney, which was infected. And that was causing her recurrent UTIs. We got the kidney stone taken out. She has not had a UTI since. So it's definitely important to go and get checked out. There's a variety of reasons, but we're pretty good at helping you solve that. Thank you so much for joining me today. I always love having you guys here and chatting with you. And I will go get on making the next best episode for you. Have a great day. Thank you for listening and spending time with me today. You can catch new episodes of Between the Sheets every Wednesday. Because what better way to add some spice to your life than to have a new podcast on Hump Day? We will continue to explore common, uncommon, and taboo topics related to sexual health and wellness. Please send any comments, questions, or stories to podcastbetweenthesheets@gmail.com. That's all one word, podcastbetweenthesheets@gmail.com. Have a great day. And remember how important it is to discuss these topics with your friends, your family, and of course your partners. In fact, you can like, follow, and share this podcast so they can see it too. See you next time for more sexual health topics Between the Sheets.